This virus spread like the plague in there.
Four Corners revealed how elderly loved ones were effectively trapped as COVID-19 rapidly spread through Western Sydney's Newmarch house in April.
I had to tell my mum that she was positive.
From that residence, 71 people caught the virus, 19 residents died during the crisis. Protocols will now decide hospital transfers. The Commission said there is no one-size-fits-all, but equal access to hospital is a fundamental right. COVID-19 had already hit Dorothy Henderson Lodge, and over the coming weeks the virus would infiltrate 220 facilities in New South Wales and Victoria. The Commission said there was not a COVID-19 plan devoted to aged care, rather a national one that was adapted. Victoria has been worst hit through its second wave. The Aged Care Royal Commission's special report found it was unclear if earlier lessons were shared widely before community transmission. Spiris's mother was one of 44 St Basil's residents who died.
No surprise, to be honest with you, that the finding was that the aged care system was not prepared. How is it that they weren't prepared after Newmarch? How is it that they weren't prepared?
The Australian government has committed to oversee the deployment of infection experts, and at least one infection control officer will be part of a provider's accreditation.
That's one positive I can say. It's not going to bring my mother back or many other lives, but moving forward, I hope it does prevent a lot more death.
The Commission concluded advice were in some respects insufficient, and it was unclear who was in charge. Even before COVID, the Aged Care Royal Commission's interim report found a cruel and discriminatory system, major quality and safety issues, understaffing and a lack of transparency.
The fact that the government has accepted all of these recommendations is good and constructive, but does not absolve them of their responsibility previously.
The Commission said the interim report noted the aged care workforce is under-resourced and overworked. It is now also traumatised.
Our members right now feel like they're on the bottom of the Titanic ship.
We had members tell us that they could only use one glove rather than two. We had members who told us they had to reuse equipment.
There was an increase in the risk of suicide. Residents experienced greater levels of depression and confusion, and allied health workers couldn't always get in.
From the time I wake up to the time I go to sleep, I'm sitting in my own room.
The government has committed to ensure adequate staff for continued visits and further measures for mental health.
There's a lot of public concern about whether or not the Minister and the government are up to the task of fixing this within the timeframe specified by the Royal Commission.
We're not shirking any of this. We're fronting up. We're looking ahead to the future management of this terrible virus. And we will continue, as I've said, to develop our plan.